We're now live.
All right, I guess I'll get started now. Hello, everybody. My name is Ogecho Heto. I am currently the Vice Chair of the Ascending Professionals Forum. I am also a medical technologist in the microbiology department in Jacksonville, Florida. And today I'll be hosting, along with Andrew Salmon, the AMA today, which is called Global Health Heroes, Empowering Communities Beyond Borders. Um, Andrew, would you like to introduce yourself?
Hi, I'm Andrew Saman. I'm a counselor at large on the Developing Professionals Forum, and I recently graduated with my bachelor's in clinical laboratory science at KU Medical Center, and I'll be starting my full-time job pretty soon.
Hey. So today we have a wonderful panel, and I would like to give them an opportunity to introduce themselves. Vicki, would you like to start?
Sure. I'm Vicki Freeman. I'm a professor emeritus from the University of Texas Medical Branch in Galveston. I don't live in Galveston. I actually live in New Braunfels, which is a little north of San Antonio in the hill country. Um, but I don't know how much you want me to say about myself, but I still work with UTMB and I still work with students, particularly our doctoral level students, taking them to Kenya.
Okay. Dawn.
So good evening. I'm Dawn Childs, and I am a program manager with Peace Corps. So I'll be talking a little bit about opportunities within Peace Corps response to volunteer. Thank you for having me.
Thank you for coming. And Ibrahim.
I'm Ibrahim Fathelrahman, and I am with the Doctors Without Border, serving as laboratory advisor, covering various countries around the world, and I will be answering questions related to opportunities with Doctors Without Borders. Thank you.
Thank you so much for joining us on our panel today. So I'm going to get started with the first question. How did you get involved with this work? How do you decide where you serve? And how does funding work? Do employers support your work? Anybody can jump in.
I can start out if you'd like me to. Um,
Of course.
I got started back in 2004, so I've been doing this for 20 years. When PEPFAR started funding the laboratory part of the treatment and taking care of people that have HIV, we found out that the laboratories in the resource limited countries did not have adequate laboratory services. And so we started out actually training individuals in the laboratory to do quality laboratory work because that was so essential for people that were receiving antiviral treatment and then be able to monitor kidney function, liver function, et cetera. And so that's how I got started in it. However, I was also involved with my church because we were working on some missions in that area as well. And my husband goes, well, you're doing some things. I'd sort of like to do it too. And I went to Ethiopia. I've been to Malawi, Lesotho, Kenya, Tanzania, Sierra Leone. So a whole bunch of different countries. And so our church was mainly working with Kenya with Malawi Methodist Hospital. And so we started going there, taking, first of all, going with mission trips, leading mission trips. And then in 2017, I started taking doctorate in clinical laboratory science students there. And what I love is I love introducing new people to Kenya and to new people to resource limited countries and them learning how well they do and how they can treat individuals with limited resources. So it's very interesting to do that. Um, I don't remember every question, so I'll try to get some of them. I do a lot of my own funding. I have UTMB did support me some with some of the travel, but I right now I pretty much am doing my own funding to going there. But I feel like it's such a worthwhile endeavor, so I like to do that anyway. What was the other? Was there another question there in there that I missed?
I mean, I think you pretty much covered it, but how does funding work and do employers support your work? But
They
it sounds like,
Yeah, when I was still, I'm retired now, but when I was still employed with UTMB, most of the mission trips I took were vacation. But when I was working with
mm,
PEPFAR, it was I was allowed to go as sort of administrative leave type, so I was able to go under UTMB that way. And then when I started taking students, I took them as a faculty member, and I still do take them as a faculty member. But and so when I was still working full time, they did give me the time to do that. But the mission work that I did was vacation time. So a little bit of both. What I like about Mount Methodist Hospital is that we've been working with a laboratory, and one of the things I've learned is that developing relationships is so important. And so I worked with the laboratory there, and I've gone from their laboratory not being accredited to them now being accredited by the Kenya Accrediting Agency. And so that's just been so great to see that progress and to take students there who work with the laboratorians, and they learn a lot, but they also teach the laboratorians while they're there. So it's sort of a two-way street with that.
that is really awesome to hear.
So
All right, Dawn, would you like to go next? I'm just going in order of my boxes.
That's good. Okay, so I came to Peace Corps. I'm actually headquarters staff and not a volunteer. And I took a position as a program manager for advancing health professionals. And it's a volunteer opportunity for healthcare professionals. So those on the clinical side, as well as like on the administrative side, although none of our positions would involve direct patient care. It's more in the academic setting. So I come from a nursing background, public health, and did a lot of work internationally as well coming over. But so, my perspective is a little different. I help, recruit and place volunteers to serve in countries where we have this program. So there is opportunities um, for different backgrounds, including clinical lab scientists. So as far as funding, if you are a volunteer, you do get your plane ticket to and from the country. You have your housing taken care of. You get a stipend to help you get the necessities and your food for, while you're there. Because the whole idea with Peace Corps is to really integrate into the community and work side by side with your counterparts and really have that chance for like cultural exchange and learn at the same time. So this particular program, our assignments are less than 12 months. Most of them are in the academic setting. So you're going to be teaching future clinical lab scientists. So those are the backgrounds that we're looking for. So you'll be working side by side with faculty members and, like I said, teaching and just building those relationships with the students and mentoring. So kind of a different opportunity to serve.
Wow, that's awesome. Ibrahim?
Yes, so I think my experience also quite closer to Dawn for the Doctors Without Borders, the same for we have our running projects in different countries, and then you will be deployed or posted to that area, and normally you will be working in a clinical laboratory or medical laboratory setting in a hospitals. Either can be run separately or jointly with the Ministry of Health. So how I joined mainly I focus in the neglected tropical diseases. My main area of specialty is a broad background in medical laboratory sciences. So I joined in 2015 in the sleeping sickness, African trypanosomiasis diagnosis. So most of it will be training and also mentoring some with the local staff. And then later, currently, I am in the HQ also. So many of my tasks to also assist those who go to the project countries and to support them with all the technical or guidance that they will need. So funding wise, the same like what Don already explained, it is already will be taken by the organization, all the accommodation and the living condition that you will be given in order to do your work. And also all our funding as Doctors Without Borders coming from individual donations. So most 90% of the donations are coming from individual person, like every individual will donate, and that will be used for specific projects.
Oh, thank you.
Okay, so our next question is, how do you find out more about these opportunities?
I guess I can start and say, talk to me about it. However, there's lots of opportunities in different countries other than Kenya. I just had picked that one because once I developed the relationship, it was the best way to continue doing that work. But there's the Global Board of Global Ministries with the Methodist Church has opportunities with that. That's the group that we've worked through. But there are other opportunities through PEPFAR and through several organizations. I know CSLI, I think ASM, ASCP, they've all been having global opportunities that you can work with and you can volunteer with. You just need to go to the website and sort of look for international opportunities and then put in a volunteer form for it. So those are the ways, I mean, I think just looking for those opportunities, they're out there.
That's great to hear. There's so many organizations out there doing that. Don, did you have any other input for that?
I was just going to, just give a little bit of background about how you can find out about opportunities with Peace Corps. So, as Dr. Freeman said, you just go online, and I'd be happy to provide the link. And I would also share my email if you wanted to speak to me directly. But right now we have positions posted for Eswatini and Malawi, and both of those are in the academic setting, so you can be at a university teaching. So those will be departing late summer, early fall because they're going to align with the fall semester. Assignments are usually, as I said, no more than 12 months. Sometimes there'll be a 6-month or 7, 8, 9, but most of ours will tend to be 6 or 12 because you're going to be there for that full academic term. So you're going to see positions out there now. For those that are going to depart around the first of the year, maybe start in that spring semester, I'm expecting to have some positions out there. Early summer, we usually need about an 8 or 9 month lead time to get through posting the positions, and then you apply to the positions and you do all that online. It'll come up with a health history. It's a basic screening, and it's going to say, are you able to go to this country? It has to be a basic screening on that, for your health. And that's to make sure that in the event that you do have any health conditions, is this country going to have the resources to be able to take care of you while you are there? If you get selected to interview, and then you get invited to join Peace Corps, then you'll go through a further medical clearance process and a legal clearance process as well. So all those things take a little time. So the positions will be out there to give you that lead time, but just know about June, July, you're going to start seeing those positions come out for about January of next year. So all the ones I have now are departing this fall.
Okay.
Yeah, I can add also, I think quite similar what I see Don explained, but for us Also, normally the availability for the person to be deployed has to be 9 months for the initial deployment. And then after that, they will be in a pool, which you will take. You can be posted for 6 months or even 3 months based on your availability. So, but the opportunities mainly, you can see them in our website, and also I can provide the link for that one. So normally, because we are an organization that working in, for example, during the crisis and conflict and epidemics, so it varies depending on the setting, but there is quite opportunity that is available, not for permanent, but can be for a short time, and then you can return back to your current position as well. Yeah.
Andrew, could I add something that for the mission work that I work with, we usually do about 2 to 3 weeks. So it's usually a much shorter time period, just to clarify that it's usually not nearly as long of amount of time.
Yeah. Yeah. It sounds like the Peace Corps and Doctors Without Borders are a lot more involved processes to get involved with.
Yeah, I mean, we have things like
Yes.
background checks and everything through the universities, but we probably don't have quite the involvement that the others do because they're not as long of a term of commitment that the others do. And usually we do a preparation period for about 6 months beforehand. Before we go, we'll meet by Zoom monthly or whatever to prepare individuals for the cultural side of things that they're going to be seeing when they're over there. So there's a commitment, but it's not quite the same.
All right. Thank you for that insight. Everyone here kind of touched on the next two questions we had, so I'm gonna skip those and move on to how would you suggest any interested individuals be able to engage in humanitarian efforts on a more local scale? Because what you guys are talking about, I would love to do. And for I think most people know, but I'm Nigerian American. So my mom's family has a medical mission they do every December, but tickets to Nigeria are so expensive. So on a local level, what can someone like me do to, help to the towards these efforts? Vicky?
I'll go first. I can tell you in Texas, there's tons of opportunities. Down by the border, there's a lot of, they call them colonias or whatever, but there's lots of opportunities in the area to go. And I know that several of the groups out, there's a Hands and Feet group in Houston that go down into the border. Lots of the churches and all are involved in border activities. And I say the border, but there's other areas as well. That's just for what I know, where I know there are local opportunities. So I would always just look in your area there. Usually the churches, for what I've seen, are the ones that really have done a lot of that. There may be more with the Peace Corps and Doctors Without Borders. I don't know, but Hands and Feet, I think, is through the Baptist Church, and we've worked with them before. They're usually just a week or so, or maybe just a few days. They're usually a shorter period of time. Some might go over a Thanksgiving holiday or that type of thing to go. But I would definitely look at nonprofits in your area. That would be the way that I would think that you would find local opportunities.
I'll go ahead and say for Peace Corps, most of our positions are overseas. That's what, serving with Peace Corps is. Although, because of the COVID pandemic, all 7,000 plus volunteers got brought home and wanted to maintain some type of relationship with our countries. And Peace Corps started virtual service pilot. So where we had people who were evacuated were able to engage virtually with the partners. We've had like English classes taught. We've had even some like basic nursing classes taught online because everyone pretty much went to that virtual platform. And those opportunities now are open to all US citizens. So maybe you can't go into the country. You can look at the positions that we have available online. It's 5 to 15 hours a week, that you would be donating your time. And that's not like all in front of the screen. You could be communicating back and forth, via email, working on a project. You could be on a Zoom call, etc. So it is something that you can do. Most assignments are going to be about 4 to 6 months in length. And again, I'll make sure, Andrew, that you have these links. But you just look at, the position online. It's going to tell you what qualifications that they're looking for, which ones are required, and then which ones that are desired. And you just kind of match your background up and say, am I meeting these qualifications? So with virtual, you would submit like a statement of interest, as to why you want to do this and how your background fits. Um, and then you would go through an interview process as well, but you don't have as much time because you don't have to be medically cleared to go to the country. So, you still would go through legal clearance, et cetera, but those opportunities are out there and you're going to see about quarterly new ones coming out. So a little more frequent posting of those positions um, more than the advancing health professionals were really kind of tied to those semesters like pretty tightly. So, but yeah, so you can serve, and I haven't seen any for clinical lab scientists, but it's not out of the realm of possibility because this time when I got my positions, I was surprised to see that we had gotten, several of them looking for y'all's background. So we'll see what we can do to see if can we somehow get that into the virtual space.
Thank you. Yes, I can add quickly. I think also for us in Doctors Without Borders, also we have office opportunities and also the field, but as a medical, mainly diagnostic and medical care services organization, most of our posting is in the field. For the offices, a lot of them, it will be for the administrative and also fundraising and associations of the medical team. And we have different sections in different countries. For example, I think for the US also we have a section based on New York. So I think people can get involved with them directly through the office there. But for the field posting in different countries, this is normally, it will be posted in the websites.
Thank you for that insight.
Okay. So supply issues, I can imagine, are definitely a problem in some countries. So how do your organizations handle laboratory supplies?
For
Think-
where I go, we're going to a laboratory, and so they have the supplies, but sometimes we ask them what donations they might be looking for. We look for donations. For instance, where I was going, we were looking to do some water testing. And so I asked UTMB if they would be willing to donate some equipment, some flasks, some filters, and we were able to get that approved through the UTMB system in order to take them. So in general, though, where I'm going to supply, they have supplies. They just might need donations, or they might need some money to help purchase supplies or whatever.
So for Peace Corps, your assignment is going to be in the classroom setting. So you're going to be teaching, in the classroom and then taking students into the lab part of that course. So you wouldn't be running any of the tests. These are positions in the area of like bacteriology, virology, so you're going to be teaching that course. The one thing that we like to do is preparing the volunteer before they go out. And once you go through all your clearances, can set up a call so you can get an idea of what textbooks are you using, get a little idea of what that classroom environment looks like. So as you go in, that you're a little better prepared to be able to teach.
So for the doctors with that, but I think supplies, especially laboratory supplies, is quite a bit challenge. Although we have dedicated supply units that is serving all the supplies from the manufacturers and delivering them to the field. But as we are currently in almost 70 countries around the world with different modalities how to deliver this supply. So always sometimes we face challenges, especially with short shelf lives, when you, especially for the microbiology or for the virological testing, sometimes we look for point of care, portable, easy to transport. But with our supply system that we have a dedicated team working in delivering supplies to the laboratories that we are running. So sometimes we face a lot of difficulty, especially during the last pandemic, COVID pandemic. Disrupted the travel and shipping and so on, but that is also gave us a big learning opportunity to diversify our supplying system to have more regional approach than one center to distribute from it. Yeah.
Yeah, and I think you make a great point there about readiness for health emergencies like that in the future.
Okay, so I have some questions from the listeners. Let me start with, let me start with this question for everyone. What are the biggest challenges volunteers face in the field based on your experiences within your own organizations?
I guess I can start with that. I think the challenges that I see as one is we go in expecting that they're going to have the same resources that we have in the US. They're going to have the same laboratory tests. They're going to have the same instruments. They're going to have the same supplies, et cetera. And that's just not true. The students that I take learn very quickly how much can be diagnosed without the laboratory testing that we have. And I think it comes as a big surprise because we're so used to having standing orders. I mean, what is not unusual, right? To have a standing order in the hospital where you, every day or whatever you get a CBC or something. That doesn't happen in these countries. And the other thing that I think that they have issues with is that where we go is sometimes the patients don't have the money to pay. And so that makes a difference on whether they're going to get some of the testing done. And they may refuse, literally refuse to have some of it done because they realize that they can't pay for it. And it really is sad. And it's really hard for the individuals that I take to deal with that, thinking, oh, here these people need this. And to us, it's not a lot of money. It may be just a few dollars, but to them, it's a tremendous amount of money. And they will refuse treatment or they'll refuse a lab test or whatever because they just can't afford it. So I think those are the challenges that I mainly see. It's I think students that go over come back with a very changed perspective of what they have in the U.S.
And I'll have to echo that. I think, one of the challenges, when volunteers first arrive is really getting, used to that differences in resources and how they use those resources, within their country. As you said, the availability of things or the cost of things. But, for our volunteers that go in and teach, they do understand that, I had this particularly for my nurse educators going in. They knew how to teach med-surg nursing, but how it looked in the clinical setting, which they could not go in, the resources were a little different, and she, I had one volunteer come back and said it just took her time, that she said, I had to learn to listen and just learn And then she goes, I've been teaching this for years, but I had to really learn how to teach it, in an environment where the resources are a little different. So I think it's kind of that transition of going in and then, getting used to it, and then they just move on through their assignments after that.
Yeah, so it is quite similar into the difficulties that normally they face. For one of them, I can say working in the humanitarian as a laboratory scientist, it's quite little bit different than the setting, the hospital setting in high income or even sometimes in the low income countries. So you need to know how to deal with supplies, you need to know how to deal with the security, you need to deal, so not only the technical part of the laboratory, but sometimes there is other interaction that you need to know or to be accustomed to. So that is sometimes it might be for the new person for the first time. It's quite difficult. Plus the rationalization of the testing, as Dr. Vicky already mentioned, that if you are coming from a setting that everything available, and then suddenly you need to rationalize certain tests. Although, for example, in a Doctor Without Borders, everything is free for the patient, but you need also to look at the cost of opportunity if you are using one test non necessarily, and then you really need it. For example, we do a lot of blood transfusions, and if you do that transfusion to a patient that not needed, and then suddenly you have a hemorrhage or a very urgent transfusion, so you might already being run from the reagent that you have. So this maybe it's quite different for the experience of the newcomers, but after a while, most of the people start to adjust to this reality and they start to rationalize. Yeah.
Thank you for that. Really quick, Andrew, before you take over, I remember the first time I went to Nigeria and I cried my eyes out. So I completely understand what you guys are saying, and you don't prepare for it. I mean, because in your mind, I don't know, you just think everybody, everywhere looks like America. So, and then you get there, and you're like, oh no, it doesn't. But so thank you guys for that. Thank you, Andrew.
Yeah, and I think this is an important topic to discuss resources, but on a similar side of the same coin is as some of you guys have already mentioned, you don't always have the same instrumentation that you're working with in other countries. And in my experience in South America, I had issues just with temperature with my instruments not liking the heat. And I kind of had to DIY situations with ice packs and hats to cool it down. Do you have any experiences like that kind of situation you've had to work through?
Yeah, at Maui Methodist Hospital, the only place on the campus that on the compound that has air conditioning is the laboratory. And that's because one year I was there and with a team that was doing some infrastructure planning, and we could show them how they could not run certain tests because the instruments overheated. And we were able to fundraise. I work with an organization that does fundraising for the hospital. We were able to fundraise and get air conditioning for the lab. And everybody else on the compound is very jealous because the lab is the only place with air conditioning. So that is interesting. I wanted to mention one other thing, if I could, with something that Dawn said about on teaching. I found it interesting when I was over there one of the first times when I was working with the university faculty and students, noticing how the students use resources differently than what we do in the US. And Don, your faculty may notice this, but they would take their, first of all, they handwrite everything. There's not a lot of handouts or anything. They're handwriting, and they would split the notebook in a line down the middle of the notebook page, and they would write on both sides of the column. So they'd have two columns. And I asked one, why do you do that? And it's because they're using as every bit of paper. Think of the times that when we write, we only use half of one side of the page. We don't always go all the way over to the right or whatever. And so that's just an example of how they've learned to use resources probably much more wisely than what we do here. I would never have thought about doing that, I don't think, before I saw them doing it. So I just thought that was an interesting story that might hit a little.
Yeah, that was interesting. Thank you for sharing.
All right, so I have another question from the audience, talking about entering third world countries and the shock. Is debriefing offered after deployment/missions?
I always hold a debriefing afterwards. We do it by Zoom since my students are all over the country, not just where I'm at. And so we held a debriefing a couple weeks afterwards where we would get together and we talk about it. But also, while we're over doing our trip, usually every evening we would have a reflection time so that the students and faculty that were there could reflect on what went on during the day. And I think that was really important too, because some of the things that they were seeing were so different than what they're used to. Being able to sort of share that and work through it, I think was really important. But then coming home after you've had a couple weeks, that getting back into the U.S., debriefing and talking about your experiences as well, I think is really important.
Volunteers have support in country. There's a whole Peace Corps staff that's in country, to support them. We have medical officers that, if they get sick or anything, then with the country directors and programming and training. And we also have local staff. I have a coordinator who works directly with the partners that where we send our volunteers, so they stay in contact with them. If there's any issues, they do have that staff there for them. So they'll be connected very closely with those faculty because that's the idea of the assignment. But they do have, in terms of if they are having any health issues or any other issues, those resources are there to take care of them during their assignment.
For the doctors also the same. We have a staff health unit that is following the staff before going to the project deployment. They do a lot of preparation, and when they coming out also they do a debriefing, and also they do for the laboratory, for example, laboratory staff, also the technical, me and my colleague in the laboratory HQ, we do debriefing to learn from the experience that they have, and if they have more suggestion or any areas of improvement. So this is one of our routine tasks that to do. Every person went to the field has to have a debrief. And also for their staff health, it will be followed up to 2 months after they come out from the country of deployment. For the 2 months, that is any concern, they will be followed by the staff health.
I'm glad there are resources there. It's very important.
Okay, so I've got an audience question asking, what does a day look like for a volunteer in the field? Do they assist in lab testing, training, or setting up labs, or a little bit of everything?
I guess I could start out again. It depends. I always tell my groups to be flexible, that we go there seeing what is needed, and then we work with the individuals that are there. Usually we are not performing laboratory tests because we don't know the instruments. It takes a while to get trained, as it would in our laboratory, to get oriented to them. So usually we're doing training. The DCLS students actually round with the physicians and the clinical officers in the hospital. And so they're learning a little bit about how the hospital operates, but they're also doing consultations with the doctors on laboratory tests. And then they, depending on their expertise, they'll spend some time in the lab doing some training, or maybe the last time I took a student was also the director of laboratory services at UTMB. And so he worked with the laboratory director or laboratory manager at MAUA in terms of their upcoming accreditation site visit that they had, because they're going to be working under the new ISO standards. And so he worked with them on that. Another one of the students wrote up an SOP for blood gases because they just got a blood gas instrument. And so they needed to have SOP. So she used their format and did that. So it's not actually doing hands-on laboratory testing, but it's more consulting and training. They also do case studies where they they find a case that's very interesting and they use that as a learning tool, and they do about a 20-minute case study to all the clinical staff, the nurses, the laboratory, the clinical officers, doctors, whoever is available and wants to come to hear that. And so that's a continued education opportunity for the staff there at the hospital as well. So we do a little bit of everything.
So for a Peace Corps volunteer, I think I've said that you're going to pretty much be in the classroom. So a typical day might be you be teaching a course. You will be going to faculty meetings side by side, like I said, with your faculty counterpart as well. You may update some of the curriculum. You'll take the class into the laboratory, the laboratory component of your course. You may mentor some of the students. So just think of someone who is teaching you. That's what you will be doing down there, is being one of the faculty members with them. A lot of our volunteers will either live close by the campus or on the campus. That would be their housing. So wherever the other faculty are is where you would be as well. So you're going to continue kind of those relationships even when you're not teaching for the day, and being part of that community is a big part of the assignment as well.
So for the doctors, but that borders mainly the person who will be deployed will be in the training and supervisory position or management based on the hospital or the clinic. So we have variable level of hospitals depending on the context. For example, if it is in epidemic outbreaks, so you will be mostly training locally hired staff in the sample transportation and assessing referral laboratories or reference laboratories for testing. But most of the time you will spend in the daily monitoring and training of the locally hired staff and improving the quality. But hands-on on the testing is very rare, but you will be in the hospital laboratory, but your task mainly will be in the training and mentoring, not day-to-day running tests. Yeah.
All right. Thank you for that. I have another question from the audience, and it says, for people who are starting or looking to start volunteering with humanitarian efforts, do you have any advice or guidance for them? So basically, how do you transition from working at a hospital to, I guess, eventually being full-time with any of these organizations? I start with Dr. Vicki.
Mine's not usually full time. Okay. So I don't quite know where to go with this question. But to get involved, to me, you just need to look around for where there's a need and then find an organization to volunteer with. There's so much opportunities out there. So I don't think there's any one right or wrong thing. You can do short-term mission stuff, or if you're working, I'll let Dawn and Ibrahim talk about those. You do longer term ones. So it just depends on what you want to do, what with your family, your background, and what you're able to do. So I think it just really depends. Just look in your community, and you're going to find there's a need.
So was the question like how to prepare for the assignment? Is that kind of what you're asking?
Yeah. Yeah. Mhm.
Yes, so for Peace Corps, as I said, the position description that you look at is really going to kind of outline what your deliverables or what activities that you're going to be asked to do. They're not so specific, but they could be general, be like teach the course, do this. You're going to see that within the position. So you can start getting an idea of what your assignment's going to look like. Another part in one of my key roles is to help prepare you to go. So getting those things I think I mentioned earlier, like if you're going to be lecturing, what textbook is it going to be? Can we have access maybe to the lesson plan? Because usually you're not going to be asked to bring your own materials. You're going to be falling in on the faculty that are at that university, but maybe they may ask you, hey, update the curriculum might be part of it, but you would never be asked to bring your own curriculum there. So, but we could give you an idea in meeting with maybe your counterpart, a couple of the faculty ahead of time to say, hey, this is what it's going to look like. This is what the classroom looks like. Am I going to be doing PowerPoint? Or, what is this, what is this day in the classroom going to look like? So I think we do as much preparation as we can for that.
I can add a small, I think, if someone after doing short assignments many times with the Doctor Without Borders, and then he was thinking, okay, I will want it to continue for the long term, still there is many pathways in the organization that you can go through, from the project coordination to the medical team lead, or if you wanted to go into the program management. So these are the current pathways that we are using them. If you wanted to go out of the short assignment, normally you have to go into the management pathways, and it is available for everyone. So from day one after you go for assignment, there is a career management team that will talk with you, and they will see how do you fit in these pathways, and if you wanted to do for a longer term, or if you wanted to continue to do a small 6 and 9 months, and every time to do a break back to your regular job and you come back, that is also one of the maintaining. They put your name in the list, and they will check with you when you will be available to go again for the missions.
Thank you for that information.
So we have another audience question. For the Peace Corps, do you live with locals during deployment? And for Doctors Without Borders and MSF, where do field volunteers stay when they're in sensitive areas?
Yeah, so for Peace Corps, yes, the idea is to live in the community. You'll have that experience and kind of experience the customs and the courtesies and develop those relationships. So again, you may end up living on campus because that's where the other faculty live. You may live outside campus and have to take, public transportation or maybe walk to the university during the day. But yes, you will live in that community. Your housing is taken care of for you while you're there. So you will have that. But yes, the idea is for you to live in the community.
For us also, the living normally, it will be in the project site where the hospital is, but in a separate compound. And normally we have a quite good separate team that deal with the community acceptance and the security of the whole team. So we have a quite good security system that is enabling the whole team and the hospital clinic to be run from the same area. So normally, for example, if you are in a remote area, it will be a compound prepared, and your accommodation and everything will be taken care of, including your evacuation if need be.
Since we're getting close to the end, I want to ask this question quickly. Was there ever a time where you reconsidered getting or staying involved? If so, please discuss, because I know these can be tough assignments that, we get into. So, Dr. Vicki?
For me, no. I've been doing it since for 20 years, and I just get more committed every time I go. Uh, the people are wonderful to work with. I learn so much every time I go. I learn something new about wherever I'm at, and I just see the need, and it just I don't know. It seems so fulfilling to go and to help out wherever you can. And I love taking new people. I say I take students, but I take other working medical laboratory scientists as well. And just introducing these individuals to some of these countries and is just very rewarding. So I never reconsidered doing it.
I have not been a Peace Corps volunteer, but my goal is to become one when I finish my time up with Peace Corps. Um, Most of us have 5-year term assignments when we come to Peace Corps, and then we need to rotate out to find another position. So my goal is to definitely serve once I leave in 17 months. I've been fortunate to be able to travel throughout Africa for, most of my career over the years, and I really look forward to be able to go down and hopefully teach in the academic setting. So it's my goal.
Me the same. I've been doing this one now for the last 10 years and I have never thought not to do it. So it is very rewarding and I always learning new things and every day is a different scenario than the day before. So it is quite interesting and I have never reconsidered like a day to stop. So I feel it is quite rewarding. Yeah.
I'm glad to hear that. I'm going to ask one more question, then I'm going to have Andrew ask the final question and close it out. But what types of testing or laboratory services are needful / useful? Like, what's the most common service that each of you provide? Okay.
Basic chemistry, basic hematology, I think are probably CD4 counts are important. So those are probably the primary ones the laboratory I go to perform. They do others as well, but just your basic CBC, or they call it full blood count FBC, and basic metabolic panels are usually very important.
For us, it's quite variable, but generally the most of it can be in the infectious disease testing and also hematological testing. And also we do a lot of blood transfusion in emergency settings. So these are the most, and plus the neglected tropical diseases, most of them are quite in need. Yeah.
So our positions don't tend to be doing the testing themselves. It's really all those courses and preparing them to become clinical lab scientists. So the asks that we get are microbiology, bacteriology, virology. We have forensics this time to help set up a forensic science program in Eswatini, which is a new one. And I did see in the chat these are university level positions that I'm referring to. So you would be with the faculty, they have a whole medical laboratory science section within the university. I think it depends on how many faculty are there, but you're there to help augment and support the other faculty there.
Thank you.
Okay, so I just had a really simple question, real quick, is just what are the general qualifications or age requirements you guys might have for someone to be a volunteer?
Age requirements for us, well, I'd say 18 and older. If you're going to be working with the medical lab, then you need to be certified, have your complete at least your associate's degree, and be certified. So, you know, I think that would be the basics. There's no upper limit as long as you're able to move around, you're mobile, because the terrain can be pretty rough and there's a lot of walking involved. So you have to plan that. Some of the trips we do, we actually do some other work besides just the laboratory work at the hospital. There's some construction. So sometimes we take individuals that will do some building or painting or whatever. So we can take others with us too. My husband usually goes along and he says my bag carrier is this joke, but he does a lot of work and a lot of coordination and everything. So there's usually work for anybody that wants to go. But and we'll take individuals, teenagers, about 16, as long as they have a parent or guardian with them as well.
For Peace Corps, there is no upper age limit. You just have to be able to be medically and legally cleared for the country. So that's really the key factors there. And in terms of qualifications, it's going to vary depending on the position. So really just look at those positions. If you're going to be in the university teaching, you're going to see probably a master's degree, bachelor's to a master's degree, depending, because you're going to have the same degree level as the faculty of which you will be working with. So just know that, you know, and those requirements will usually come from whatever the university standard is for their faculty members. So, but it could vary. So just look at them, just pay close attention to those requirements that are listed in the positions.
Same for the doctor with the body, there is no upper high age limit. So as long as you are able to do and to travel, and at the same time for the qualification, we have to be a certified laboratory scientist and or laboratory technologist, and that means you are able to work in the country of your origin, and then you will be okay to join and to have a 1 year experience at least, because you will be the one to train a lot of local recruited staff.
Wow. Thank you guys so much. Thank you, Don, Dr. Vicki, and Ibrahim for a great, great AMA. I learned a lot, and I'm pretty sure the listeners did as well. If you guys have any other questions or want to get started, of course, reach out to these individuals. And on that note, I just want to say good night, everybody. Bye.